Okay, class. Let's begin today's learning. Uh, this is about the pediatrics, and this part is the assessment of growth and development. Uh, we will from the seven parts. One, the growth and development law. Two, factors affecting growth and development. Three, physical growth. 4. Development of other systems related to physical growth. 5. Neurophysiological development. 6. Evaluation of child neurophysiological development. 7. Developmental behavior and physiological abnormalities. The key and the difficult points like the measurement and the normal value of child physical growth and development indicators. Correct evaluation of child growth graph. Development milestone system of child neurobehavioral development. Main clinical manifestations of attention deficit hyperactivity disorder (ADHD). 2. The characteristics of physical development, bone development, tooth development, and organ development, types of growth disorders, developmental screen towards course of attention deficit hyperactivity disorder. 3. Clinical manifestations of breast holding episodes, toe sucking addiction, layer beating, insurance, and child rooming syndrome. Medical treatment for attention deficit hyperactivity disorder, and clinical manifestations of Alzheimer's disorders and sleep disorders. Then we from the first section, the law of growth and development. The growth and development are continuous phase process. The growth is continuity and long uniform speed development stage. Weight and length are the first growth peak after the first year. We can see male or female, this is the first year, the growth is faster. And the second peak of growth occurs is the female is about 12 and the male is about 15. The growth and the development of various systems and organs are unbalanced. Follow certain rules. 1. The neural system develops early. The brain and develop faster within 2 years of life. The limbic system grows rapidly in childhood and reaches its peak before puberty. The reproductive system develops later. Development of other systems would likely parallel physical growth. The different speed is related to the physiological functions of children at different ages. We can see the size in the term of tree of total growth. 3 is the individual difference in growth and development. Due to the genetic and environmental influence, there are individual differences. There is a certain normal range, but not an absolute one. Different influence factors of individuals must be considered in the evaluation. The second section is the factors that influence growth and development. One is the genetic factors. Genes are the material basis of determining inheritance. Genetic factors in both parents. Genetic information of race and family. Genetics, metabolic disease, endocrine disorders, trauma, some malformations are more directly related to heredity. Sex-chromosomal genetic disorders are sex-related. 2 is the environmental factors. Nutrition, intraterm malnutrition, after-natal malnutrition. 2. Acute infection, weight loss, long-term chronic disease like weight and height, endocrine disease, bone and nervous systems, congenital disease, the growth retardation, maternal conditions, maternal failures, infection in early pregnancy, severe malnutrition in pregnancy, certain drugs, X-ray irradiation, environmental toxicity, and mental trauma, family and social environment, living habits, scientific learning, good education, physical exercise, medical and health care service. The third section is the physical growth. 1. The common indicators of physical growth. Physical growth, selected indicators that are easy to measure and are representative of a larger population. Commonly used morphological indicators: weight, height, sitting height, top hip long, and head circumference, chest circumference, upper arm circumference, suctus fat. Physical growth rules from birth to earth young. 1. Weight gain. 2. The growth of the figure, the growth of the head circumference, the growth of chest circumference, the growth of the upper arm circumference, substantial fat, body proportion, and symmetry. 1. The weight gain. Survey results of 2015 male infant weight is 3.38, and the female weight is 3.26, close to the WHO reference value. 3.3 male and 3.2 kilograms female, 2 times that at birth from 3 to 4 months after birth, and 3 times at birth is at 12 months is about 10 kilometers, 10 kilograms. The second years of birth is 2.5 to 3.5 kilograms, and from 2 years old to early young is the weight gain is 2 kilograms per year, and the formula for body weight estimation for normal children we can see, and the boy is the weight is about 3.50 25, and if the 3 to 12 months of age is the month plus 9 and percent 2, it is the 2 2 to 6 years old and 7 to 12 years old. The growth of the figure height or length height refers to the total length of head, spine, and the lower limbs. Body length is measured in the spine position under 3 years. The growth pattern is similar to weight, affected by genetic, endocrine, and intrauterine growth levels. 2. Sitting height to top hip length of head to is kept to bursty in the supine position under 3 years, representing the growth of the head and spine. The distance between the figures of the two upper limbs representing the growth of the long bone of the upper limbs. If it's less 3 years old, we can need the line position test, and the Armenia 3 years old, we use the standing position measurements. Formula for estimate length in normal children. The bone is 15 centimeters. If the 3 to 12 months of age is 75, and 2 to 3 years old, we can use this, and 7 to 10 years old, we can use this. The head circumference, the upper margin of the eyeball arch, and the axial nodules surround the length of the first week. Growth is associated with the growth of the brain and the skull. Being most valuable under 2 years. Continuous tracking measurements are more important. Excessive growth rate hinders the growth of the head circumference. We can use the age we like the big boy 3 months, 12 months, 24 months, 5 years old. At age of 15, we can use the acute head circumference. The chest chest circumference. The lower edge of the flat lips is flat around the chest through the lower edge of the scapula represents the growth of the lung and the thorax at birth. 22 centimeters, slightly less than head circumference. About 1 year old, 1 year to early young head circumference is flat edge. Cross time of head and chest circumference, growth and development of nutrition and chest, cross time of poor growth, and this picture it shows the growth graph of the head and chest circumference. This is the head, and this the chest. We can see that this is the in 1 year old the head and chest circumference almost is clear, and then the chest circumference is more than the head circumference. The upper arm circumference and the middle point of the acromegaly line around the arm represents the growth of muscle, bone, subcutaneous fat, and skin. Rapid growth within 1 year. 1 to 5 years is about 1 to 2 centimeters. Left upper arm circumference screen for the nutrition status of children age is 1 to 5 years old is more than 13.5 centimeters was good nutrition. 12.5 to 13.5 centimeters was moderate nutrition, and less than 12.5 centimeters was more nutrition. The subcutaneous fat, lipid thickness, subcutaneous fat, common used measurement size, abdominal wall soft fat. 2 is back subcutaneous fat. Measurement tool is measuring skin for caliper. This is the body per proportion and symmetry. Head to body length ratio of head, trunk, and lower limb length change during the growth processes. The proportion of head length or height is 1 per 4 in newborns and 1 per 8 in adults. We can see the fetal is about 2 months. The head is about half the length. Body per proportion and symmetry. Body symmetry, proportion of body growth, such as weight of height, chest circumference index, quarter index, calf index for young children, constitution index of height, BMI for age, and so. Body symmetry, sitting height and height ratio, the growth of the lower limbs, body proportions remain in juvenile state. Disease affecting lower limbs growth, such as hamster, autism, and shoulder dystrophy, finger distance and height. Finger distance is greater than 1 to 2 centimeters of height. To of abnormal growth of long bones, such as spider-like finger, we call the horse syndrome. The clinical significance to determine the types of short status. Considerable short status. Asymmetrical short status. Abnormal length or heterogeneous type. Slow growth of lower limbs. Related skeletal disease. Endocrine diseases. 3. The physical growth lower of puberty. Adolescence is the second peak of physical growth. Peak height velocity with obvious gender difference. Height and weight increase rapidly. The weight increase parallel to height, while the internal organs increased girth from 9 to 12 to 11 years old. After about 1 to 2 years of breast development, before measured 8 to 9 centimeters per year. Boys, 9 to 10 years per year, centimeters per year. After testis, enlargement at 11 to 12 years old, 13 years old. Female, fat accumulations in the breast and some bone. Male, shoulder weighting, lower leg length, and muscle enhancement. And this picture is shows the physical growth law of puberty. This is the first growth peak, and this is the second growth peak. Puberty, early puberty appears. Girls is less than 8 years, and boys is less than 9 years. Delayed sexual development, low secondary sign appears. Girls is more than 14 years old, and boys is more than 16 years old. Physical outgrowth evaluation. 1. Principles. Choose appropriate physical growth indicators. The most important and commonly used more vertical indicators are height and weight. Head circumference should be routinely measured. Use accurate measurement tools and standard measurement methods. Select the appropriate growth standard or reference value. It is recommended to select the reference value for the growth and of Chinese children developed in the 2006 WHO Child Growth Standard, or the physical development data of Chinese children in 9 cities in 2050. According to the situation, child growth standards was assessed regularly, and growth monitoring tool is the evaluation content. Growth level, the location of a physical growth index in the same age and gender population. 2. Growth rate, the growth value of a single physical growth index in a certain age stage is the most simple and intuitive growth rate in terms of the growth curve. And regular physical examination is the key to evaluation. 3. Evaluation the relationship between body growth indicators. Body symmetry indicates the